Let me begin this bulletin first updating you first about the fact that COVID pandemic is still on, and importantly, what is the status? 25,000 cases and over have been reported in just 24 hours. What is the current status? Active cases stand at 3,33,924. Total recoveries, that's the good news, about 3,16,80,626, while death in last 24 hours have been 389, which means looking at this data, remember, COVID pandemic is still raging, is still on. Take care of yourself and your families. Get vaccinated. Now, the big story of the day is about primarily whether the third wave of the COVID pandemic is still imminent. There has been, under the Ministry of Home Affairs, a report has been submitted to the Prime Minister's office, which states: 1. There is a third wave that is imminent. 2. The pediatric facilities need to be prepared at the soonest. And if there is vaccination for the kids, the pediatric facilities be prepared, but use vaccination for children with caution. This is one of the most crucial studies that have been submitted to the PMO. Take a look at this special report at the top of 6.
The third wave is upon us, but pediatric facilities are nowhere close. This is the warning from a panel of the Ministry of Home Affairs. A committee of experts constituted under the National Institute of Disaster Management, or the NIDM, has recommended creation of better medical facilities for children who might be at similar risk as adults.
All governments, state governments, have taken this conscious decision not to denotify the COVID care hospitals. They have increased the capacity to produce oxygen and also the availability of hospital beds for children.
The report is based on projections made by several panels that say the peak of the third wave is going to be in October. The report says pediatric facilities, including doctors, staff, equipment like ventilators, ambulances, are nowhere close to what may be required in case of a large number of children getting infected. If a child is positive, then there should be a place where hospitals can accommodate the parents as well. There is a cause for worry according to public health experts, since children below 18 years remain unvaccinated in India. The panel recommended that vaccination among children should be top priority while dealing with the anticipated third COVID wave. Vaccination of younger children and children with comorbidities should be an immediate future priority. Teachers and school staff must be vaccinated as essential workers throughout the country.
We should not panic but prepare well. There is no biological reason that children will be affected more in the third wave. There is a lot of damage, collateral damage done to the children's health by COVID-19 apart from directly affecting the children, like education, nutrition, mental health, and we should concentrate on everything.
Will the Delta Plus variant be the driver of the third wave of the pandemic? This is a question that has been asked in the report by all of these members, because there is still lack of clarity right now and emerging evidence on whether or not Delta Plus is actually more transmissible and more dangerous than its parent, the Delta variant. That was the reason behind the second wave in India. In New Delhi, Sneha Mordani for India Today.
Remember, this is one of the most significant studies that have been done. I'm going to go across to my colleague Milan Sharma, who's tracking the latest on this. Milan, because you've been covering the pandemic ever since it started, how prepared do you think the country is? Is the government putting in place, with all these studies, at least some precautionary measure? So if at all the third wave appears, India is prepared. What are you picking up from the ground?
Pooja, well, the report that has been submitted by the MHA 40 expert panel to the PMO itself says that the infrastructural requirements and the preparedness is still nowhere close to where we should be at this moment. And this should ring alarm bells, because we need more pediatric ICU beds. We need more COVID care centers for children, as the maximum number of adult population now moves closer to getting vaccinated. Children are going to be the top priority. Remember, as soon as the Union Health Minister Mansukh Mandavia took charge, he had issued a package that would be used to create these facilities for children across various states with the contribution of the state as well as the center. So definitely work is being done on this particular front. But right now, one other good news we have is Zydus Cadilla's Zycov-D vaccine for children has been given an emergency use authorization. But the company spokesperson have said to India today that they'll only be able to create 1 crore doses by October. And the report says that we could see a third wave hitting anywhere from 15 July till October. So this is the time that we need to prepare on war footing to save our children, to protect them from the impending third wave, even as schools continue to start opening in various states, Pooja.
And no excuses anymore if at all that chance does come, if the third wave does come, that there are enough studies that the government has been prepared for and should be prepared at all this time. Thank you so much, Milan Sharma, with all the latest on that. Now remember, this is while the vaccination drive is still on. I want to now bring you up to speed of where does India stand with its vaccination drive. So in total for now, this is the updated data we have from the Health Ministry. Take a look at that. 58 crore 25 lakh 49,595 total doses have been administered till now. What does that mean? The first dose at about 45 crore 15 lakh 13,534. What about the second dose, the most crucial booster dose? 13 crore 10 lakh 36,061 doses till now. These are numbers. I want to now tell you what does it mean with regard to India's population. The first dose, the manner in which it has been now given to the adult population, 47.79% Indians have been vaccinated till now. But what about those fully vaccinated ones? Only 13.87% Indians have for now been fully vaccinated, and that also means despite that we can still catch the coronavirus and can still face serious problems. Nevertheless, do get vaccinated as well. All of this, remember, our source is the Ministry of Health and Family Welfare. Now let me take you through daily vaccination tracker across all the states. The vaccination drive is still on. Let's begin. Last 24 hours, about 10 lakh 60,218 doses have been given. Tamil Nadu for now is at the top. Tamil Nadu has been giving its people maximum doses, both first and the second, but the lowest, the northeastern state of Manipur, where it stands at about 417 dose one. Only 909 in the last 24 hours. So Tamil Nadu on the top, Manipur at the lowest for now with the daily doses that have been given. All of this data is to help you understand where does the country stand. But I want to now take you through what the government has to say. I want to now take you briefly back a few months ago. What did the newly appointed Health Minister Mansukh Mandavia had said in the Parliament about the vaccination drive of India? Important to remember what the politicians tell us and promise to us. Listen in.
क्या 130 करोड़ की जनता, सभी सरकारें, देश के आम नागरिक साथ में मिलकर तय करें कि हम देश में तीसरी वेव नहीं आने दे। हमारा संकल्प, मोदी जी का मार्गदर्शन हमें तीसरी वेव से बचा सकता है, हमें संकल्प करना है।
So the DNA vaccine, which has just received emergency use authorization, is, in fact, we've just informed also that this is going to take about 4 weeks before they can bring out the doses for the immunization program. Which children will get immunized? What will be the categories on which they would be immunized? This is going to be a larger decision which will be taken by the NIDM working group on COVID, because they will have to decide, considering how much volume is going to be available. Knowing this, that this is a new technology, a new platform, it does take time for the scale up of this vaccine.
So remember, our politicians have been maintaining that the country is fully prepared. I'll quickly go across to one of my colleagues as well. Sneha Murdani has been getting us all the latest on that. Sneha, my question to you is, at this point, when the politicians have said that we are well prepared, even with the third wave that is coming, and we saw your report as well, where do you think the government stands? Because it is crucial, with so many studies, one by one coming in, is the government keeping its focus intact? What's the ground situation? Over to you, Sneha Murdani.
All right, yes, Pooja, in fact,
with Sneha very soon, but what we do know is that for now there have been different studies that have come to the government's notice, and we'll wait and watch how the government has been reacting on that. Now remember, the COVID pandemic is not just about India. It is a global pandemic and every country has tried to put in efforts. One of the countries that appeared to be emerging victorious was Israel. It was one of those countries that had managed to vaccinate all of its people. But just in few months ago, while it appeared to be emerging out of the pandemic, in April, it also became one of the countries to open its economy fully. But what happened then? Everyone thought they are free, they can come out in public. But now one of the most immunized countries is in the middle of a worrying new surge that has forced authorities to administer the third booster dose. As per the latest data by Johns Hopkins University and Israel's Ministry of Health, the country recorded over 6,279 cases by August 18, a significant spike after the country vaccinated 50% population on 15th March, at a time when the country identified the Delta in April. Now compare Israel with the neighbors. Countries like Bahrain, Qatar, UAE have been reporting significant rise in COVID cases as well. A third dose of the Pfizer COVID-19 vaccine has significantly improved protection from infection and serious illness among people aged 60 and older in Israel compared with those who received 2 shots. These are the findings that have been published by the Health Ministry on Sunday. So remember, vaccination does not mean that you're all clear and you're all safe. You still need to ensure that you take all precautions so that you and your family stay safe.